Hi, my name is Dr.
Gaukhar Baidildinova.
This video is a part of my lectures on evidence-based medicine and epidemiology. In this part about the differences between case control and cohort studies. In case control studies, researchers start with people who have a disease, cases, and compare them to similar people without the disease, controls, to find possible causes. Cohort studies, on the other hand, follow people over time to see if an exposure, like smoking, diet, or medication, leads to a specific outcome. This helps determine cause and effect relationships more clearly. A single study may investigate different outcomes. For example, if a cohort of smokers is studied, it is possible to record deaths of lung disease, cardiovascular, and cerebrovascular. This distinguishes them from case control studies, which evaluate only one outcome. The line in the middle is the present. In the case control study, you go down the stairs to the past. In retrospective cohort studies, you are immediately in the past and go from there to the present. In prospective cohort studies, you go from the present up into the future. Case control studies are always retrospective. That's their natural characteristic. Cohort studies, on the other hand, are more often prospective. Since case control studies are people either interviewing patients or reconciling records, it's unequivocally much cheaper to do than to specifically study patients in the present-future tense. In the first case, we get quick results by examining a relatively small population. In cohort studies, you have to wait a long time, a minimum of 3 months, and so, as you saw in the example, cohort studies can last a year, or 2, or 5. As we know, even smoking and alcoholism do not kill quickly. In case control studies, the study population is relatively small. In cohorts, however, it can be several hundreds or thousands of people. Case control studies are appropriate for rare diseases and inappropriate for rare exposures. Cohort studies, on the contrary, are appropriate for common diseases. For example, type 2 diabetes, cardiovascular disease, coronavirus, and are appropriate for rare risk factors. Case control studies focus on the study of only one condition. Cohorts can register several at once. For example, type 2 diabetes often goes hand in hand with obesity and cardiovascular disease. Cohort studies have fewer problems in measuring exposure because they are prospective studies. The main source of bias in case control studies is the inappropriate choice of control subjects, and in cohort studies, it is the selective exclusion of participants. When you exclude someone, there should always be a rigorous and clear rationale for doing so.